These are some complications due to extension of acute aortic dissection, and the best way to think of these is to imagine the aortic dissection extending into a structure and then think about what the outcome is from that structure. So if you have an aortic dissection extending into the carotid artery, that can cause a stroke. So those are up here. If you go up into the carotids, that patient can end up having a stroke. If the aortic dissection extends into the carotid sympathetic plexus, that can lead to Horner syndrome. If it extends into the aortic root or the aortic valve, you can have acute aortic regurg, which makes sense. If you're damaging the root of the valve, you'll have valve dysfunction, you'll have regurg. If it extends into the coronary artery ostia, you can have myocardial ischemia and infarction. If a dissection extends into the pericardium, you can have pericardial effusion leading to tamponade. If it extends into the pleural cavity, you can have hemothorax. If it extends into the renal arteries, which are in the background here, you can have renal infarction. If it extends into the mesenteric arteries, you can have intestinal ischemia. Lastly, if it extends into the spinal arteries, you can have lower extremity paralysis.